Hi Joan, my name's Chelsea. I'm the nurse practitioner on an urgent care today. I've reviewed your chart and your symptoms are pretty consistent with a UTI or a urinary tract infection. That's why I went ahead and just had them grab a urine sample from you. So that's running now. We're just kind of waiting on those results to come back. Essentially, a UTI just happens when bacteria enters through the urethra and makes its way up to the bladder and kind of colonizes there. That leads to the symptoms that you're experiencing. So the burning, frequency, urgency, and urination. It can also lead to some cloudy or foul-smelling urine. Sometimes, just depending on irritation, it can lead to a little bit of blood in the urine as well. So we're just kind of waiting for those results to come back. I'm planning on starting you on an antibiotic called Bactrim. Just depending on, again, those culture results, we'll call you in about 24 to 48 hours. Go ahead and pick up the antibiotic prescription and then just wait for the go-ahead from us to get that started, just to kind of eliminate those bacteria in the bladder. It usually takes about 1 to 2 days for symptoms to kind of start resolving. So in the meantime, I'm going to start you on a medication called Pyridium. It's specifically for urinary tract pain, so you can keep taking that in addition to Tylenol and ibuprofen if you've needed that for discomfort. Just be mindful that the pyridium can turn your urine a bright orange color, so if it looks like Gatorade, don't be alarmed, it's totally normal. And then just a few other things you can do in the meantime too, as we're kind of waiting for those results. Again, just crank up the fluids, lots of water. Whatever you want to drink really is fine. I would probably avoid any caffeinated beverages just because they can tend to cause more frequency and irritating the bladder. So I would avoid those, and then cranberry juice tends to help as well, so you could give that a go. In the future, to prevent UTIs, I just recommend a few things. So wiping front to back first and foremost, practicing good hand hygiene, of course, and then sometimes they are from after having sex. So just urinating, emptying the bladder after that happens to help kind of flush out any bacteria that might have found its way up there. So before you hear from us again, just keep monitoring your symptoms. If anything gets worse, things feel more severe, you spike a fever higher than 101 degrees, or if you start to feel pain down here in the flank is what we call it, or like lower back and side, that could be an indication that the bacteria has just kind of made its way up to the kidneys. So in that instance, it would be much more severe and we'd need you to call or come back in right away. I don't anticipate that happening, being as your symptoms just started a day or two ago. And then once we get those urine results back, we will call you, have you start the antibiotics, and then again, just 1 to 2 days from there, you should notice an improvement of your symptoms. If we do have you start those antibiotics, just make sure you finish the whole course. Usually it's going to be about 7 days, so make sure you take all of them, finish the whole prescription, just to mitigate that the chance of the bacteria coming back. So if you don't have any questions for me, we'll go ahead and have the nurse come in and just review this information with you, and then we'll get you home.